I had a patient call me. He had a stroke, and in the process of him having a stroke, he sustained burns on huge parts of his arm, like right here. He wanted to consider Botox. He was like, tell me where to go for Botox. And I said, well, you know, a neurologist can help you. Majority of the time, they work with people with nerve injuries. What's funny is he didn't understand the purpose of why you would have Botox injections. So when you have a stroke, your brain gets injured. So your brain injury is on the opposite side of where you get injured. So he had left hemiparesis. So that means his injury was to the right part of his brain. So he has a lot of tone. So when you have an injury to your brain, as it heals itself, the signals are all jumbled up, if you can imagine. And it's sending the signals to his muscle, but it's sending it incorrectly. So it's sending to certain groups of muscles all the time. So then your muscle is really tight because it has no ability to relax. And then the other group of muscles doesn't move enough. It doesn't have enough movement. So the group of muscles that is really, really tight, it's called tone. It pulls people in. When you have a stroke, when you consider Botox injections, it's to paralyze the muscle. So if the injury is here, you're going to come to the source and you're paralyzing certain groups of muscles so that it doesn't constantly pull in so much. You get those Botox injections every 3 months. His other problem is he has an orthopedic issue, meaning the tone pulls him in, the scar pulls him in, and he just told me, a surgeon down there says, oh, well, you have all these nerve problems because the scar is pulling your nerves down, and that's why you need a surgery to then wrap around that nerve so that it doesn't get pulled in. But why would you only fix that one problem when there are 3 other problems? 1, his tone is so strong. 2, he's got a big scar that pulls him in like this. So if you wrap the nerve so that the nerve moves better, how is that even moving? Because currently you're not moving, so you're stuck. So you're gonna have a surgery and then you potentially gonna get stuck one more time. So if you're going somewhere and they're only concerned with one problem when there's 3 other problems, so they can fix the nerve, but the muscle's gonna be too short. You are going to fix the nerve problem, but then the wrist is still gonna sit like this and compress and push on that nerve yet again. You have to fix here and fix the scar. The scars from burns are different from just a regular cut. So there's a lot of different things to think about. So it takes time to take care of. Once he started getting better, he stopped taking care of it as much, and now it's coming back. So we get a little bit better, we're like, oh, we're a little bit better, and then we're like, oh, okay, going to therapy is extremely tiring. I get it, but it's necessary. Otherwise, we'll be talking about like having 3 more surgeries.